Thank you, Morgan. I want to thank all the speakers today. I want to especially recognize Crisanta for all her hard work on this. She's been a voice from the very beginning, and Christine, Howard, Suzanne, all those personal stories. Basic health care should be a right. It should never be a privilege. We decided that as a country decades ago when we made it an absolute right that you could show up in an emergency room and receive care. So one of the questions that we need to decide is, why are we fighting over simple cost-saving methods by which, rather than waiting until someone's already in extremely dire circumstances, why are we waiting for that to occur before we give them health care and access for it? That was a huge part of the Affordable Care Act, was to make sure more people could get insured in the private sector. We set up our exchange here to enhance that capability. We expanded the total coverage of people in Colorado to 94%. That's the highest it's ever been in the history of the state. But the proposals that were before both the House and the Senate would have ripped away coverage for tens of millions of people in the United States and many hundreds of thousands of people in Colorado. In Colorado, we're looking at up to 600,000 people maybe losing their coverage. This is not the time to go backwards. This is the time to go forward. And I certainly recognize, I think almost every governor, the people that really implement healthcare will tell you that there are improvements to be made to our system. We're not arguing that. Let's figure out, how do we navigate these high-cost pools and figure out the right approach to reinsurance so that we spread that cost over a much larger number of people, and so that a small pool isn't penalized with incredibly high increases in their health insurance. The solution to these are not a single partisan solution, which is pretty much what we've seen nonstop from Washington. And I would argue that we want not necessarily a bipartisan solution, we want a transpartisan solution. I think we need to have a transpartisan solution to stabilize the markets, to reduce the costs, to make sure that we continue to expand access. I think this is really about representing and reflecting the will of the people of America. You look at every single poll, somewhere between 85 and 90% of American people were against those proposals as laid out. The fact that they were still being tried to jam through with a strictly monopartisan, unipartisan, totally partisan approach is in many ways a defiance of democracy and what democracy should stand for. So I think we need to get back to the states. I've talked to probably 30, maybe 35 governors about this, and it's interesting. It doesn't matter whether you're a Republican or a Democrat. I haven't talked to a Republican governor yet who wants to roll back coverage. Right? They're not sure how they're going to pay for it. They're working out the financing. A number of the Republican governors were strong enough and courageous enough to stand up and talk to their senators and really lobby them to wait until we can get a transpartisan solution. I think that there are solutions there that we'll get to, but not until some of the dust settles and we agree that as a country we are going to deliver, make sure that we deliver on that promise of health care to every single person. And as is always the case, I think Colorado is going to be one of the anchors of this, one of the leaders in this, one of the models in this. Is going to be able to provide some of those examples. I know that, that's how we do things in Colorado. We put aside the partisanship, we sit down together, and we say, all right, what needs to be done first, what's second, what are the critical elements, what are the priorities, and then let's get to work. That's the Colorado way that we know to get things done in this state. It's a way to get things done in this country. It's why Drive Our Lives is here, to make sure that we all understand that. Drive Our Lives is led by one of my favorite Americans, someone who has spent his entire, I would say his entire life in public service. There might have been 1 year in there that he was in private practice. But he has worked for civil rights and individual justice. He was the first person anywhere in Washington to recognize that training and apprenticeships could be a doorway into a better future for millions and millions and millions of Americans. And he has been, from the very beginning of taking over the chair of the DNC, he has been a relentless fighter for the rights of all people to have health care. My good friend, let me introduce the chair of the DNC, Tom Perez.